I find it difficult to say, because I'm neither a physician nor an epidemiologist. I'm not going to submit my judgment, political judgment, for the medical judgment of practitioners who are trained in this area. So there's, I did mention a little bit about the testing, and I guess given the member's interest, I'll add a little bit more to the record. So according to the information I have, Lyme disease should be diagnosed through a clinical evaluation of the patient's symptoms and risk of exposure to infected ticks. A blood test may also be administered, supported by laboratory testing by the BC Centre for Disease Control, but this should not be interpreted in the absence of a clinical diagnosis. The BC Centre for Disease Control Laboratory Services recommends a two-tiered approach to Lyme disease testing. First, blood samples are screened with a sensitive enzyme test, then positive or suspicious results must be confirmed with a highly specific Western blot test before Lyme disease is positively identified. This approach is also recommended by the Association of State and Territorial Public Health Laboratory Directors and the U.S. Centers for Disease Control and Prevention. The BC Centre for Disease Control cautions against the use of invalidated tests for Lyme disease or interpreting results without appropriate guidelines, as this can lead to a high number of false positive tests. For example, some private labs in the U.S. use a different standard of interpretation and thus return a false positive result on almost every test. So the that's an important note, and I guess a final note on this. And again, I'm not trying in any way to diminish this patient's issues. I'm trying to report to the member that this is a complex issue, and at some point, hopefully, the patient and her family can find a physician that they have confidence in. They can find a testing regime that is appropriate, and that a proper diagnosis is made of the patient. As the Centre for Disease Control cautions, and I'm quoting here from them, inappropriate antibiotic therapy for misdiagnosed Lyme disease can and has killed patients in the prime of their lives. So one has to be very careful. Medicine obviously is science and evidence-based, but it is not always a perfect science. The practitioners, the physicians, those who administer laboratory tests, those who interpret laboratory tests, are all part of a system whereby the diagnosis is based on evidence and science, and it is often the best that is possible in sometimes a world that lacks complete certainty. So again, one has to be careful about moving forward here, and one should move forward with the best advice possible. And the BC Centre for Disease Control, I think, has, from our governmental perspective, both the scientific basis, the evidence basis, the expertise to provide that advice.
Member.
Thank you, Mr. Speaker. Obviously, caution and prudence are called for whenever these situations present themselves to the people who would be qualified to make those judgments. But it should be more certain than just saying hopefully they can find a specialist. Hopefully they can find someone who will address those issues, when in fact the minister is committed to helping that happen and ensuring that that does happen. And although the minister has pointed out accurately that there should be prudence, there should also be a critical haste, because there are so many people who are on death's doorstep because of these symptoms. And if the minister wants to put things in context, he can look south of the border and towards eastern provinces that do recognize more readily Lyme disease, where there are thousands of % more recognized cases just across borders. So it's kind of like 15 passenger vans. There's a lot of Canadian jurisdictions that don't recognize their dangers, but physics don't change at the borders, and ticks don't need passports. So, you know, wherever you have animals that have ticks, you will have Lyme disease. You will have humans who have Lyme disease. There is Lyme disease in animals in BC. And if the minister goes into any veterinarian's office, he will see pamphlets on Lyme disease. And pets are treated as a matter of course when they present with symptoms. And they are cured. But we're not offering this to the citizens of British Columbia. In the meeting I had with the minister, he explained the circumspection he holds for the American testing by pointing out that they were private labs and had a private motive, which seems very largely ironic coming from the government that has taken the steps it has in terms of privatization of the system. So, you know, if the motives are an excuse that one might hide behind in interpreting test results, well, then we should address some other issues in this House as well. And I think that the minister made commitments to this family. They are desperate. There is no more time left. They are looking for someone who will fly their daughter to California. And I am asking anyone I know with connections to anyone who might have that power available to them. And so I'm asking the minister, because the minister has that power, if he will ensure that that patient gets the treatment she needs, either here in BC or in Redwood, California, where she has been accepted to a Lyme specialist.
Thank you. I wonder if I might ask the member, what is the body of evidence which would lead us to conclude that Redwood, California is a place for her to go?
Member.
The clinic is run by the foremost private lab that tests for Lyme in the United States. And I can get the minister all of the information he might require.
Minister.
Thank you. So again, the member said a number of things in his response, which I hope were a product of concern and frustration. But I got to say to the member, no one in British Columbia is saying that Lyme disease does not exist in our jurisdiction. No one has ever said that. The issue is the incidence and prevalence of Lyme disease in the province. And it is around the issue of incidence and prevalence that the debate that I talked about earlier exists. And so again, I think you know, the member can disagree and conclude that California is the place to go. The best advice, and I think we have been trying to assist the member in this and assist the patient and family in this. The process here is to make a request to the attending physician, and the request to the attending physician that the patient should see an infectious disease physician. And we understand that there are specialists in infectious disease in both Victoria and Nanaimo. The member may advise that all of those have been exhausted. But again, at some point, we need to display, I guess, some faith and trust in the learned physicians that we have who are experts in this area. And so I think my view is the best course for the patient is to try to get the best advice from an infectious disease specialist from either Victoria or Nanaimo. We're glad to assist, as I said to the member at the time, in trying to expedite that. But I mean, the member can send along the information he has on the Redwood facility. There are provisions in the medical services plan for out-of-country travel to access specialists that are not otherwise available in British Columbia. Those need to be approved prior to the patient departing, but that is an option that's available.